This is Bob Maranto, managing partner of Andrews Bernstein Maranto, continuing our discussion regarding the types of doctors you may see if you're involved in a motor vehicle accident and injured the spine. We've previously talked about chiropractic, physical therapy, neurology, and pain management doctors, and now I'd like to talk to the kind of the last result for people, which is the orthopedic surgeons or neurosurgeons. And neurosurgeons are surgeons that can do surgery anywhere in the nervous system, in other words, the brain and the spinal cord. Orthopedic spine surgeons are limited to doing surgery on any part of the spine. And those surgeons are called in when there is a problem with the spine that is not reacting conservatively. In other words, when people have had chiropractic or physical therapy, pain management, neurology, and they're still not having an alleviation of their symptoms, then the neurosurgeons or the orthopedic surgeons are called in. And if there is a disc that's determined that there's a disc pathology, and here on this model, I'll squeeze it so you can see what I mean by disc pathology, that is causing the problem, then the neurosurgeons will come in and address that specific problem. And they do it, they're surgeons, they do it surgically. So there's a number of different types of surgeries that we see or may be offered to you. And we can have surgeries from a foraminotomy to a laminectomy. Oftentimes what we're seeing when there's this type of a situation is what we call a discectomy. Discectomy meaning removal. So they remove the affected tissue, the disc. And you can imagine here, if that disc is pushing on the nerve or the cord, we want that off. And one way to do it is to remove it. So they cut this off. Now, if they take the whole disc, now there's a space there. Well, we need something there. So what the doctors will do is that they can use cadaver bone, they can use your bone, or there's also surgeries now that have artificial discs. And these are discs that are meant to act like the human body, a disc that is replaced into the vertebral bodies in between after this disc is removed. And that disc has some functionality to it, so it can still be used to bend or side bending or front and back bending. Other times that can't be done, and then the surgeons will then put some type of a plate in here to then take these two vertebrae, if it's a one disc procedure, and fuse these and then put a plate here to hold everything in place.